Wakefield Talking Therapies is a free mental health support service. Wakefield Talking Therapies is for anybody who is experiencing low mood, anxiety, any common mental health problem. From 16 plus, there's no upper age limit. You need to be registered with a Wakefield GP in Normanton, Knottingley, Castleford, Wakefield City Centre, Pontefract and Featherstone. So a lot of people who may come to seek support may say, oh, I wish I'd come years ago, because they've been feeling this way for a year, 2 years longer, and they've been coping, how they can, but they've not wanted to come for support because they didn't feel bad enough or they didn't know where to come. So the best time for someone to come to our service is when you start noticing those changes, those subtle changes, such as, not picking up the phone to people, your loved ones or anything, or making excuses not to go out, or maybe phoning in sick more at work, or not going to the gym, whatever you would normally do. What gives you a sense of, achievement or pleasure or anything, those things, what you stop doing, and it's going to impact your mood. It's going to make you feel more anxious if you're not going to go out more. It's going to make you feel down, upset because you're not enjoying those things that you used to enjoy. And the more that goes on, it can be more difficult to get out of those patterns, and we start avoiding more, and our world gets smaller and smaller. You can come years after, that's absolutely fine, but the best time is when you start noticing those little things, to come to our service and give us a call. Go online if you don't want to give us a call if you're feeling anxious. Just reach out to us and we can get the ball rolling, and leave it to us then, and we'll help and support you through them next steps. Or if you notice someone, a family member, a loved one or a friend or anybody like that who you've noticed is backing off a little bit or not quite themselves, reach out to them, maybe say, oh, Wakefield Talking Therapies could support them. So it might not just be you, it might be a work colleague, a friend, a family member, and you just start recognising these subtle changes, and our support, our treatment can help you, give you the tools to be able to regain that, to give you the confidence and to give you the tools to be able to put in place to help you get back into what you enjoy. When people come into the service, we'll do an assessment to start with to establish what would be best suited for your need. So that might be low intensity treatment, which would look at CBT, cognitive behavioural therapy, or it might be counselling approaches. We also have treatment what covers here and now, giving you guided support through the interventions. We also have couples therapy, and all these types of treatments that we offer come in lots of different kinds of ways we can deliver that treatment. So we have the traditional one-to-one treatment where you would see a therapist maybe weekly, but we also offer online treatment. So if you can't make it into the service and you prefer to work through it in your own time, we offer the online where you would still get support by one of our therapists. If you can't physically come into one of our clinics, we can do telephone appointments, we can do video appointments. We also offer group therapy as well, and we do have a Wakefield Talking Shop, but we also have clinics, GP, colleges that we do treatment in, so it is accessible for anyone. We do go on what you want and what you would benefit from around your life and your other commitments. The type of mental health difficulties that we may cover in our service is low mood, anxiety, low self-esteem, OCD, health anxiety, stress management, phobias, PTSD as well. People can come to us and present with lots of different kinds of anxiety. So that can be generalised anxiety, health anxiety, social anxiety. There's a lot of different kinds of anxiety that we can help support through our treatment. When someone is experiencing low mood or anxiety, sometimes it's very common for people to have thoughts of not wanting to be here anymore or hurt themselves in some way. And we do as talking therapies work with people like that and who have thoughts like that, because they are very common, and we help support you through that. However, if you had them thoughts and you had intentions on acting on them thoughts, we wouldn't be the right service for you at this time. We would have to look at alternative services in our area that we work very closely with, and we would guide you through that. We would help support you through that and refer yourself to them. If you're struggling with an eating disorder, or if your main concern is alcohol or drug misuse, we would look at all these individually. We do work with such a vast amount of organisations in the Wakefield area. We have meetings with them, we talk to them, we understand their organisations. So our job is to be able to, even though we might not be the right service for you at this moment in time, you might need more support somewhere else, or you might just need more specialised support for specific things. That's absolutely fine. We can guide you and signpost you to these services. We can help refer you to these services, or we can give you the contact details and more information about these services, so that you're not with us, and on our waiting list waiting for support that might not be, right for you. There's telephone, there's on our website. You can also call into our Wakefield Talking Therapies. You can email the service. Also, if you have got any professionals, midwives, health visitors, or even your GP, they can help you self-refer into our service, but you don't need to. You can self-refer yourself. Once you've got in touch with us, one of our client advisors will get in contact to gather a bit more information from yourself about your availability for an assessment, and then you will be booked into an assessment with someone like myself, and we will go through questions of what's happening at the moment, how it's making you feel, come up with a treatment plan together. And then what would happen is someone like myself would go and discuss it with our supervisor, because we've got lots of different treatments in our service. So it's good to talk to someone else about what we've gone through in the assessment, just to make sure that we offer the right treatment for yourself. Then we'd give you a call and we'll offer all those treatment options to yourself, and we'll have that discussion together to come up with the right support for you at this time. We are very lucky in our service to have employment for a team of dedicated people. You can access this while you're on a waiting list, waiting for treatment, or within treatment. So if we're doing some work together and you're saying to me, I'm struggling at work at the moment, my boss doesn't understand, or I'm off sick at the moment, but I really do want to get back into work and I think that would help my mental health, that is something that we can refer straight to them, and you can have that support, that one-to-one support from them while you're in treatment. So it's not them or us, it's us working together. Also, recently we have started an employment group as well, so a work wellbeing group. So that's one of our therapists and also one of the employment advisors. So that would cover that group. It just works really well. I've had a lot of successful things with my clients with that, definitely. All our therapists are trained with long-term conditions. With yourself, be able to work through any adaptations you might need in treatment, access to treatment. Also in treatment, you might need longer sessions, you might need shorter sessions, you might need certain bigger techs. There's lots of adaptations we can do in service. SilverCloud is our online platform, and we offer it to a lot of people who come into our service. So there's two different ways we offer SilverCloud. So something what's called unguided would set you up on it. So you would receive a link through your email account and you click on it. We can guide you through that if that sounds daunting. We have a vast amount of modules. We have depression module, anxiety module, health anxiety module, stress management module, OCD, lots of different kinds of modules. And we can add to that as well. So we can add resilience sections to it, confidence, lots of different parts to make it for you, to make it personalised for you. So the unguided approach is us setting you up, and that you don't want any further support, you don't want us writing to you or getting in contact with you. So we would set you up on that, and then we would discharge you from the service because that's what you want and that's all you need from us. So you would have that support for a year, and you can access it. You've got diaries on there, so you can, and it's all can be attached to your phone. So while you're working in the park with your children, whatever, you can log on. If you started feeling anxious or anything like that, you could log your thoughts down. You could look at breathing techniques. So it's all accessible there and then, not just in a therapy session. That's the unguided, but you wouldn't have a therapist attached to that. You would be in our service for that. But then we also do have the same modules, but guided. So what we mean by that is when you come into service, we will have to do an assessment just to establish what module would be best suited for you. And also it would mean that we would set you up and you would have weekly reviews with someone like myself, and it'd be written reviews. So we would look at what you've done in that week. If you've been struggling, we might be able to adapt it and add something else to it, or we would prompt you where to turn on the platform, and we would write you a nice warm review saying well done. Or if you're finding it a bit difficult on some of the sections, we might organise the telephone review with you as well to talk through that, because sometimes that can be easier to just have a 10-15 minute chat with us just to explain the intervention together. So yeah, we offer that, and that'd be offered 6 reviews. So if it's not working, or if it's not quite you, or you feel like, oh no, I want to talk to someone, or I want to join the group because now I'm feeling a bit more confident or something like that, absolutely fine. We can review that throughout treatment and we'll go from there. Our workshops and webinars are a perfect taster. So if you're quite unsure about therapy, you're a bit anxious about coming to therapy, it's a good stepping stone into therapy. Coming to a workshop or a webinar, it gives you an idea of what therapy might look like, what it might entail. You don't need to refer into our service for them. You don't need to have an assessment. You can just go onto our website and look at the range of workshops and webinars we offer. These change throughout the year as well. We offer lots of different kinds of workshops for different times of year. So in January, we might have January Blues, or we have lots of different kinds of workshops that you can just click on and you can access and book yourself on. You don't have to have your camera on, you don't have to speak, you'll never be put on the spot to ask any questions or anything. When people are feeling low and down, people can isolate themselves from others, people that they love, they care about. They might feel like a burden to other people if they reach out to others, but actually having people around you who may understand how you're feeling, and knowing that you're not the only one who's feeling that way might help you feel not alone and supported. So if you are struggling to reach out, or you're not quite sure to reach out, please take that first step. I can understand that if you're feeling anxious or you're feeling low, that first step might feel a bit daunting, but I can reassure you that you're not alone. There's a lot of people who come into our service who feel exactly the same as that. And for you to take that first step is the first step for your treatment.